Hello and welcome. We'll just give it a moment or two while attendees join before we start. All right. Hello and welcome, everyone. We're very pleased to welcome you today to the second webinar in our ongoing free webinar series called Weaving Rights into Women's Realities. This webinar is hosted today by the Women's Human Rights Education Institute. Founded in 2004, the WHRI has been offering CEDAW and international women's human rights capacity building programs to women's human rights defenders from around the world, including in-person and online learning programs which focus on women's rights advocacy. We are passionate about CEDAW as a tool to support feminist activism. For information on our upcoming programs, including additional webinars in this series, please subscribe to our newsletter and follow our social media. I will share links to those in the chat later. I'm very pleased today to welcome our two speakers on this important and timely topic, prioritizing reproductive health needs in times of crisis, advocacy, and international women's human rights mechanisms. In today's webinar, our speakers will explore the different national, regional, and international human rights mechanisms that are important for reproductive health in times of crisis, how and when to use them, and how you can fit international mechanisms and frameworks into reproductive health advocacy. Daniela and Bhavya will share specific examples of how to use the UN mechanisms to advocate in contexts of crisis, including sharing case studies exploring the impacts of crises on reproductive health, including rising fundamentalisms, war and invasion, climate change, as well as the global pandemic and other crises that we are living through. I'll briefly introduce each of our speakers, and then I'll be happy to hand it over to them. Our first speaker today is Bhavya Joshi, who is the founder of Women Sara, an organization in India dedicated to the full realization of sexual and reproductive health as a human right. Bhavya is also pursuing her doctorate at the School of Public Health at the University of California, Berkeley, and we're very pleased to have her work as an educator with us here at the Women's Human Rights Institute. Daniela Drandich is a reproductive rights program lead at RODA, Parents in Action, where she works on education and advocacy programs for respectful maternity care. She has used UN, EU, and national human rights mechanisms in her own advocacy efforts and has collaborated on national, regional, and global shadow and thematic reports. She has an MSc in maternal and infant health and an honors BA in European studies. And at the Institute, we have been very pleased to collaborate with Daniela in the past on offering training programs specifically around respectful maternity care and human rights. A few housekeeping things before we jump in. I think everybody is familiar with webinar formats by now, but just to remind you that at the bottom of your screen, you'll see a couple ways that you can engage with the panelists today and with each other. If you click chat, that's going to open the chat. I see a few of you already saying hello in there. I see some familiar names, so welcome to friends, new and old. So you're welcome to use that chat to say something about yourself, share about your work, interact with each other, as well as us, and I'll be monitoring the chat. We will take a Q&A. We'll take questions towards the end of the session. For the Q&A, instead of using the chat, I would ask you to look for, at the bottom of the screen, there's another button that says Q&A, where you can input your questions, and that way they'll be organized in an orderly format for us to take to the panelists. We'll do our best to answer as many questions as we can, but hopefully a lot of the questions you have right now will be addressed through the presentation itself. So again, I'm really happy to welcome everybody, including our panelists. At this point, I'll hand it over to Bhavya.
Great, thanks, Angela. Am I audible? Perfect. Firstly, I'd like to begin with thanking the Women Human Rights Education Institute for hosting this space. So good morning, good afternoon, good evening, everyone for joining today. And thank you for joining us today. Daniela and I are very excited to be here and to share more about our work, which lies at the intersection of reproductive health of women and girls in times of crisis and human rights. Today's webinar's topic is prioritizing reproductive health needs in times of crisis, advocacy, and international human rights mechanisms. And as we unravel different layers of this complex and relevant topic, our aim is to primarily focus on one, different national, regional, and international human rights mechanisms for reproductive health in times of crisis. Two, how and when to apply the international human rights mechanisms. And three, how international mechanisms can fit into reproductive health advocacy. We will also try and weave in some cases, case studies, examples of where we have used human rights mechanisms for reproductive health advocacy in our work. Next slide, please. Thank you. So that's broadly the agenda for the day. It's divided into 4 parts, and I request whoever is comfortable sharing in the chat, and I do see a lot of comments already, to please share your name, country you're zooming in from, and an organization or institute you're affiliated with. Also, please feel free to share in the chat in case you worked with international human rights mechanisms before or used them before in your advocacy work, if you worked with women's reproductive health or in times of crisis. And this can go on parallelly in the chat as we begin with the webinar. All right, next slide, please. Thank you. So given our diverse audience today for this webinar, it is only fair to begin with some definitions that we will most commonly use throughout this presentation. So let me begin with defining reproductive health. So according to the Program of Action from International Conference on Population and Development in 1994, that was held in 1994, and the World Health Organization, reproductive health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity in all matters relating to the reproductive system and to its functions and processes. So typically when we speak about reproductive health, we look at it from a life cycle approach, meaning menarche to menopause, and it includes areas that you would have commonly heard as adolescent health, menstrual health and hygiene management, maternal and child health, family planning, among others. And now, since we're speaking about reproductive health in times of crisis, it's also important to define crisis, which in international humanitarian law is an event or a series of events representing a critical threat to health, safety, security, and/or well-being of a community or a large group of people. Now, these could broadly range among various scenarios from armed conflicts to political instability to natural disasters and even pandemics. Hence, we can say that crisis is understood to be times of great difficulty and danger or threatening situations that require urgent action. And these are the two key concepts and frameworks that we will be basing our presentation today on. Additionally, next slide, please. Thank you. My doctoral research also focuses on 2 key concepts. The first of which is continuum of crisis. Given the times we live in today, my hypothesis is that crisis is a continuum and will continue to be so. This basically means that we are facing a crisis at all times, may it be the impact of climate change, natural disasters, wars and invasions, pandemics, political instability, and whatnot. And we've been living and getting impacted by these crises for a few years now. Now, these impacts could be direct or indirect on us. They might also range in terms of its severity and frequency, but we do see that there has been a continuum of crisis, and we've seen patterns globally in terms of this. The other key concept is compounded crisis, which I define as one or more events of crisis or a series of events. And it recognizes the compounded impact of multiple crises, and it also recognizes the underlying factors that makes a sudden event very critical. All right, next slide, please. Thank you. So let's begin with understanding the landscape of sexual reproductive health worldwide. Next slide, please. Thank you. So earlier this year, UNFPA, which is the United Nations Population Fund, published its report, State of the World Report, which reported 121 million unintended pregnancies in low and middle income countries. 45% of abortions were unsafe globally. And worldwide, 43% of women are unable to make decisions about their own sexual reproductive health. Now, these numbers are showing an upward trend when we compare it to what the numbers were pre-pandemic. So for example, the Guttmacher Institute reported around 200 million unintended pregnancies, which now have increased by almost 20 million in low and middle income countries alone. Next slide, please. So where are we today? We've recently seen the overturning of the Supreme Court decision on Roe v. Wade in the United States, which has impacted the right to abortion for millions of women and girls in that country. There's rising fundamentalism, leading to reduced access to sexual reproductive health across many countries, and we'll use examples of some of these countries later in the presentation today. There's been a deprioritizing of sexual reproductive health in policies and funding by different governments and global health institutes. So 7 of 10 government donors only allocate, 7 of the top 11 government donors only allocate 2% of their funding to gender equality programs. This is a number that came out recently in a report by the working group in 2021. There's been little to no accountability for violating women's reproductive health and rights. There are existing discriminatory laws and policies, and also we've seen a backward trend in meeting sustainable development goals, which is also something that recently came out in the sustainable development goal reports. And a lot of maternal child health goals that were established in 2015 seems a distant dream now. Next slide, please. So it is fair to say that sexual reproductive health in itself is in a state of crisis. And as you remember, crisis we defined as an event or series of events representing a critical threat to the health, safety, security, and well-being of the community. And here we're talking about women and girls in general. And hence, it is fair to say that given all these discriminatory laws and policies, the rising fundamentalism, decisions, Supreme Court decisions like Roe v. Wade that are impacting sexual reproductive health of women and girls across the world, it is fair to say that sexual reproductive health is in time of crisis. So what really happens when SRH is led with crisis? So if we work under the hypothesis that sexual reproductive health is in a state of crisis, and then we layer it with an event of crisis, for example, the Ukrainian refugee crisis, the Russian invasion of Ukraine, and what's happening there is millions of refugees, women and children primarily, are crossing borders or are internally displaced. So that is an event of crisis which exacerbates the issue for women to access their reproductive health and rights. Now, it could be further exacerbated if there are series of events or crises. So for example, the same group of women who are crossing borders or are internally displaced are also doing so in times of the pandemic. There have been COVID outbreaks. There have been reported COVID outbreaks in these movements. There have been climate impact that has been reported with heat waves running across several parts of Europe and that region, where women are getting further affected in accessing basic health services. And it's worst hit among the marginalized groups. So for example, within that population that we're using here as an example, women who are pregnant, women with disability are facing even more implications. Hence, this layering is how we need to understand sexual reproductive health here on, and we need to understand that with the compounded crisis framework, it's becoming even more difficult for millions of women and girls across the globe in different geographies to access basic sexual reproductive health needs and services. Next slide, please. So as I mentioned, compounded crises are on a rise and will impact millions of women and girls, especially their sexual reproductive health, and especially because it is a taboo subject And we'll see more examples of that in this presentation later on. There's a growing need for collective advocacy at all levels, may it be national, regional, and international. So today, our aim is to share some examples of how we can use international and regional human rights mechanisms for advocating for sexual reproductive health and rights. Next slide, please. All right, so in this section, we will focus on next slide, please. 4 mechanisms, tools that we can use that are in the United Nations system. The first is CEDAW, which is the Convention on Elimination of All Forms of Discrimination Against Women. We'll talk briefly about the general recommendations or comments to CEDAW. We will also discuss about the special procedures and the regional human rights mechanisms. So we begin with CEDAW. So CEDAW is one of the 10 human rights treaty bodies. It builds on a range of initiatives to center women in the work, especially in the United Nations. It was drafted in 1970s and has entered into force in 1981. CEDAW is also one of the most ratified UN human rights treaty of all 10 and their optional protocols, with over 189 state parties to it. This basically gives it the status of customary international law, which means that whether it's ratified or not, states are bound by meeting its human rights obligation when it comes to women's rights. CEDAW also provides, next slide, please. It also provides a very comprehensive framework for women's rights on principles of non-discrimination, state obligation, and substantive equality. The convention itself is comprised of 30 articles, which can be broadly categorized in 6 main sections. The first part deals with general obligations of the state and the framework of the convention. The second part focuses more on public life and civil and political rights. Part 3 focuses on economic and social rights. Part 4 focuses on legal status of women, including family law. So the private sphere focuses more on the private sphere. Part 5 is on the form and function of the committee, and part 6 is on general provisions. The convention also has an option protocol, which was adopted in 2000, which basically gave committee the power through the communications procedure to receive complaints by women on behalf of women from countries who have ratified the optional protocol to CEDAW. And this is crucial because this is what gives women human rights advocates, activists, civil society organizations the space to advocate for women's rights in this committee. Next slide, please. Then there are general recommendations to CEDAW. Now, each of the UN treaty body publishes its own interpretations of the provisions of its respective human rights treaty in the form of general comments or general recommendations. The CEDAW committee issues general recommendations, which are considered authoritative statements on the meaning of the provision in CEDAW with respect to the rights of women and the obligation to state. So as of earlier this year, CEDAW had adopted 38 general recommendations. The 39th is in its draft state and it has called for inputs going on right now, and it's on the rights of indigenous women and girls. So we're yet to have the 39th officially adopted, but it's underway. And then Article 21 of the CEDAW Convention is what empowers the CEDAW committee to make these suggestions and general recommendations based on the examinations of the report and information received from state parties. So this is not necessarily a direct tool to be used for advocacy, but is a great tool to get more information and understand the expansion of rights in CEDAW for different themes and subjects. Now, these general recommendations are typically mandatory for states to include in the information related on these key subjects into their reports. So that's also why it becomes important to know about these recommendations and understand how some of the women's rights are expanded in different themes and subjects. So just for examples, general recommendation on 19 and 35 focus on violence against women. So if your work is in that space, you can use these tools to understand these rights in a more expansive manner, in addition to what's already stated in the convention. and then use that information for advocacy. The two general recommendations that are relevant for this topic that we're speaking of today is General Recommendation 24, which is on women and health, and then General Recommendation 30, which is on women in conflict prevention, conflict, and post-conflict situations. Next slide, please. So how can women human rights advocates engage with CEDAW? The first option is through the optional protocol mechanisms, like I mentioned, and the tool that you can use is individual complaints. So the CEDAW committee can receive and consider individual communications, which are also known as complaints, from or on behalf of a person or group of persons claiming to be victims of a violation of the convention by a state party. So for the committee to be able to receive individual complaints, the state party concerned must have recognized the committee's competence by ratifying the optional protocol. And there are over 100 countries that have ratified. So this is something for you to go back and see whether your country has ratified the convention or not, and its optional protocol or not, to be able to use this mechanism. The second is the Universal Periodic Review, as we commonly call it, UPR. And through this mechanism, you can obviously submit a shadow report. So when you know your state party is reporting to the CEDAW committee, they typically take out the list of the countries that are reporting months in advance. So you can keep a track of it through their website and know whether your country is reporting or not. And then you can submit a shadow report. Now, this shadow report can be a coalition submission with multiple organizations working on a certain theme or working in that country collectively to publish and submit this report to the committee, or it could be thematic based by one organization as well. So you don't have to write about the state obligation for all articles under CEDAW. You can focus on some themes and also use that. Once you get to the UN, there is typically a public NGO briefing, which I think, if I'm not wrong, happens on Monday when the session starts, which is like a political formal statement you make to highlight the key issues of your work and that you feel where the state has not fulfilled its obligation to protect and promote human rights, especially women's rights. Then you have a private lunch briefing, which is kind of more a private event where the committee members who are working on your country reports will kind of meet you in this brief one. Sorry, I seem to have dropped off. Am I audible and back now? Yeah, okay, great.
Yeah, you're back.
Thank you. All right, so I was at private lunch briefings, which are these kind of private events where you have a one-on-one with the committee and you can expand more on the key issues that you're working on and your organization is working on. Then is the constructive dialogue between the state and the CEDAW committee. And there's finally the concluding observations, which are the set of recommendations given by the CEDAW committee, which you can then use for advocacy work at your national level. And in the end, there is also an inquiry procedure, which may be initiated if the CEDAW committee receives reliable information indicating a grave or systematic violation by a state party of any of the rights contained in the convention. So this is also an important mechanism that can be used to engage with the CEDAW and advocate for sexual reproductive health and rights in particular, but also any right that is promised in the convention. All right, I think with that, next slide, I'll hand it over to Daniela.
Thank you. So then in the next section, we're going to talk about the special procedures. And what are the special procedures? Basically, they're independent human rights experts, and they have mandates to report and advise on human rights from a thematic or country-specific perspective. As of October, there were 45 thematic and 13 country mandates. These people generally aren't paid. Actually, not generally, they are not paid experts. They work on a voluntary basis, and they're elected for 3-year mandates that can be conducted for another 3 years. With the topic that we're talking about today, with the support of the Office of the United Nations High Commissioner for Human Rights, or the OHCHR, special procedures can do certain things like undertake country visits, act on individual cases of reported violations and concerns of a broader nature by sending communications to states and to other bodies, and they can contribute to the development of international human rights standards. Finally, they can engage in advocacy, raise public awareness, and provide advice for technical cooperation. There are a lot of human rights, there are a lot of special procedures, like I mentioned in a slide earlier, and there are a few that are especially relevant for sexual and reproductive health and rights. For example, the Special Rapporteur on the Right to Health, whose full name is mentioned here. The Special Rapporteur on Violence Against Women, the Working Group on Discrimination Against Women and Girls, and the Independent Expert on Protection Against Violence and Discrimination based on Sexual Orientation and Gender Identity. And finally, the Special Rapporteur of the Rights of Persons with Disabilities. Those special procedures that are relevant for crises, the Special Rapporteur on the Promotion and Protection of Human Rights in the context of climate change, Special Rapporteur for the Human Rights of Migrants, the Special Rapporteur on contemporary forms of racism, racial discrimination, xenophobia, and related intolerance, and the Special Rapporteur on torture and other cruel, inhumane, or degrading treatment or punishment. So how can civil society engage with these special procedures? You can prepare submissions. So by sending them a submission through their submission tool, you can tell them about a situation that's happening in your country. It can be thematic, in which case you write to one of the special rapporteurs that are dealing with the theme that your problem fits under, or it can be a country-based, in which case you go to a special rapporteur in the case that there's one for your country or region. You can participate in a call for inputs, which basically is when one of the special rapporteurs publishes a call that says, I'm looking for inputs from civil society on such and such a topic where we would like to hear what's happening. We had a call for submissions from the Special Rapporteur for Violence Against Women, which happened just before the COVID crisis, where she was asking people to submit information about obstetric and gynecological violence. And a lot of NGOs participated, after which she prepared a report condensing all the main topics and themes of things that were happening and presented it to the United Nations General Assembly. Finally, they can engage in country visits and other visits that are related. The way that this works is that they become invited from the state, or they ask the state if they can come and visit. And we had a visit from the Special Rapporteur for the Right to Health a few years ago in Croatia, which was very, very interesting and very helpful in our advocacy work. These are some examples of some of the submissions that we've prepared. On the left-hand side, you have our the piece from our website talking about what the submission is, and on the right-hand side, you have what the submission looks like. We were talking about lack of access to abortion services guaranteed by law, and this was one of the pieces of work that Bavia did with Roda this summer, which we're very proud of. One of the things that the special procedures have implemented recently is an online form where you basically input information into an online form that can be saved for up to 24 hours, as opposed to writing the kind of old school type of submission, which I showed you in the previous slide. From what I can see, this is brand new, and it's no longer possible to send submissions in the way that we've done it previously. So if you're planning a new submission or a submission in the next few months, know that you're probably going to have to use, well, you will have to use the online tool. This is just one of the options, just to give you an idea of what it looks like, but you go through it, and basically as you pick different options, different aspects of the form open up. In addition to the UN human rights mechanisms, there's also a number of regional human rights mechanisms, which we've also used at ODA a number of times. The logic behind the regional human rights mechanisms is very similar to the logic behind the UN mechanisms, and the logic among the different regional mechanisms is also similar to each other. So once you have a basic idea of how they work, you have a basic idea of how all of them work. I'll give you some examples of regional human rights mechanisms that we have in Europe. We have something called the Council of Europe. This is the organization that involves all the countries in the geographic area known as Europe, and they are all signatories to the Convention on Human Rights. The Council of Europe has a commissioner on human rights, a parliamentary assembly, and the European Court of Human Rights is under the umbrella of the Council of Europe. So basically, these are all the countries in the region that we call Europe, in addition to the European Committee on Social Rights. Just to make things more interesting, in Europe, we also have the European Union, which is a smaller organization only of the countries that are members of the EU. And here we have the European Parliament and parliamentary committees, especially committees like FEM, which is the Committee for Gender Equality. Under the European Union is also the Charter of Fundamental Rights of the European Union and the EU Agency for Fundamental Rights, which is known as its short form FRA. In Africa, the African Union has the African Commission on Human and People's Rights, the African Court on Human and People's Rights, and the African Committee of Experts on the Rights and Welfare of the Child. And finally, the Extraordinary African Chambers. So as you can see, there are regional differences in the way that things are kind of put together, but the themes and the logic are always more or less the same. In the Americas, there's the Inter-American Commission on Human Rights, the Inter-American Commission of Women, the Court of Human Rights, the American Declaration of Rights and Duties of Man, and the American Convention on Human Rights. When we're talking about the Americas, this more or less includes both North, South, and Central America. In the Americas, there are 11 thematic rapporteurships. They're listed here, and if you're interested and if you're registered for the webinar, you'll get this in PDF form so you can look at it in more detail. When we're talking about compounded crises and sexual and reproductive health, there's different aspects that we can look at. And one of them is fundamentalism. In many of the countries that we're living in currently, fundamentalism or just extremism is something that we're seeing more and more of. In my context specifically, we're seeing religious extremism, where in the global north especially, pressure is being put on governments to limit women's reproductive rights. And these are usually led by well-funded Christian evangelicals or the Catholic Church. There's also the issue and problem of white supremacy, where there are structures that are designed to marginalize and hurt people, especially women who are not white. And extreme political parties, groups, and individuals who are using a clickbait culture, which leads to a rise in extremism in political discourse and online, with algorithms on social media, and especially on video tools that are designed for radicalization. If it's ever happened to you that you're looking at something on YouTube and you keep clicking what it offers you as a suggestion, you see that you can quite quickly go down a rabbit hole of really sequentially more extreme information. When we're talking about climate change and sexual and reproductive health, we can talk about extreme weather events. What happens when there's an extreme weather event? There are service disruptions. There's difficulty accessing services. Staff and facilities are endangered or they're not able to attend work. There's an increased number of injuries and disabilities, and a difficulty or inability to attend educational programs, especially for women and girls. This has a trickle-down effect where in the aftermath of an extreme weather event or an extreme event like an earthquake, there's also difficulty later on with providing services in the 5 to 10 year period afterwards because people weren't able to go to attend educational programs. And finally, after extreme weather events, there's often changes in funding priorities for governments who are moving away from health investments into infrastructure ones, which obviously does have a place, but it's also very important to always have in mind that sexual and reproductive health. When we're talking about disruptions due to climate change, we can talk about supply chain issues for medications and equipment. Right now, for example, there is a supply chain issue in many countries globally with plastic pipes that are used for giving women epidurals during childbirth. This is just one example of a tiny piece of plastic that, because of a supply chain issue, is causing enormous problems. And the same can happen for medication and other essential equipment. It can happen that there's a lack of funding and political will to invest in research and quality improvement programs, which means that things can stagnate, especially if a country or a region is not doing very well with sexual and reproductive health and rights. When some pressure is put on it because of changes because of climate change, there's less and less political will to invest in quality. And there is difficulty accessing continuing education. For example, in new abortion techniques or methods, currently right now, for example, many countries are starting to adopt medically induced abortion services, but climate change in some settings is causing problems with healthcare providers having access to these types of continuing education. Bhavya?
Yeah, thank you. All right, so we now move into a case study which kind of ties reproductive health access with times of crisis and using international human rights mechanisms. So we're going to use a case study of floods in Assam and Odisha in India. So Assam is a Northeast India state. Odisha is an East India state. Assam borders with China. Odisha borders with Bangladesh. And these are both states with high maternal mortality rates. These are also states that typically face floods every year because during the monsoon periods, which is around this time of the year, because the rivers that are close to them overflows into the villages and rural areas around them. So earlier in 2020, Women's Sara, my organization, conducted a study on sexual reproductive health services that were provided during disaster relief efforts. And these were some of the findings that came out. First, that menstruating women were expected to keep a distance from men of the family and follow separatist customs like eating from separate utensils, washing their hair only 3 days after 3 days into menstruation, and sleeping and sitting in isolated places. Secondly, it was found that menstruation hygiene practices were often compromised because there just wasn't enough mechanisms, and there weren't enough washrooms or disposal mechanisms where women could practice menstrual hygiene practices. Women were also not using sanitary napkins, and this is one of the major findings we found across even different regions, that often the organizations or the governments that are working on relief response give these hygiene kits to women that may or may not be catered to their needs. And this was an example in Assam in particular, where women do not know how to use sanitary napkins. They often use a cloth pad, and they were given sanitary napkins in these relief, these responses that were carried on, and they continued to make their own local arrangements to use old cloth because they just didn't know how to use sanitary napkins. Next slide, please. In this study, it was also found that more than 40% women practiced open defecation during floods, which we can imagine would have led to so many more infections and unhygienic conditions. Women avoided using toilets as there were very limited facilities and there were no separate facilities for women, which was a big compromise on their privacy and dignity. There was also a lack of proper bathing facilities that led to skin and UTIs among women. I would also like to read a quote from one of the respondents in the study. I started my periods the day the water started flowing in our house. Our priority was to relocate to a safe location. Some local youths came to help us in the evening. I wanted to change my menstrual cloth, but we didn't have enough time. I was lifted up by one of the rescuers so we could leave faster. The temporary shelter was not far away from my house, so I decided to come back to get a clean cloth when the waters receded a bit. I was uncomfortable as my cloth had got soaked. It was an added discomfort in the crowded camp. I could not think of anything else. When morning came, I quietly went to my house and managed to find a piece of dry cloth. I kept the soiled cloth in a plastic packet and came back later to wash it. Of course, the name has been changed for anonymity reasons, but this is one of the respondents describing the challenges of menstruating women during a natural disaster. And this report and these findings were also shared by us to the working group when they were called for inputs for their annual thematic report on sexual reproductive health in times of crisis. And this is a great example of how you can use some of your findings or your research studies or your projects findings, etc., to then document them and share them with these international human rights mechanisms for advocacy. Next slide, please. Wars and invasions. So we are taking here the example of the Russian invasion of Ukraine. I had the opportunity to work this summer in the region with some of the organizations that are on ground working on the issues, and even interact with a few women refugees that are in Croatia, Ukrainian women refugees that are in Croatia. So the war in Ukraine is on its eve of completing 6 months. I think in the next couple of days, it will be 6 months that Ukraine is undergoing and its people are undergoing this massive crisis. As of early August, UNFPA published a report where it said some 12.1 million people are estimated to need health assistance, 15.7 million require protection assistance and services in Ukraine, some 6.6 million people remain internally displaced, and over 6.3 million refugees are recorded in European countries. It's estimated that there have been almost 434 attacks on health facilities in Ukraine. So this is really where the situation is at the moment in Ukraine and in the region, and the impact that the population of Ukraine continues to face because of this invasion. Next slide, please. So what happens to sexual reproductive health when an event or a crisis like this happens or occurs? One, there's disrupted healthcare delivery. This crisis is called a women and child crisis because more than 85% of the people who are crossing borders are women and children. And despite that, there has been a lack of reproductive health access for women. There have been a lot of pregnant women who have not been able to get basic maternal health services and other menstrual health services, etc., which we'll see examples of in a minute from now. There's also gender-based violence that happens. In June 2022, ActionAid reported almost 124 cases of gender-based violence, and there's obviously more and more data coming in. These are cases which takes time to document and publish, and so we are expecting a massive number to come in the next few months that would be reported cases of gender-based violence. There's trafficking that's been happening. World Vision's surveys said that there are 97% of respondents in Romania alone reported hearing of incidences of human trafficking amongst Ukrainian refugees. So obviously, these are some of the massive impacts that we are seeing of this crisis. And in terms of the disrupted healthcare delivery, next please. UNFPA reported that 265,000 pregnant Ukrainian women had compromised access to basic health services, including maternal care services. Next, please. So during my study and interactions this summer in Croatia with organizations working on this crisis, one of the respondents, and I've kept it anonymous because they didn't even want their name out. Reproductive health was not a priority in emergency response. One day we decided to keep a box of sanitary napkins for the women arriving at the border, and it was emptied within 10 minutes. Women often do not communicate their reproductive health needs due to the taboos associated with it. And this is just one of the many stories and many examples that are coming out from the field. And this is also, can we go back? Sorry, I just quickly wanted to add that these are also situations that we need to document and raise awareness on, because often in these crises where there's so much media reporting happening and there's so many events of, as we call, minor crises happening within the bigger crisis, a lot of these stories get undocumented, a lot of these situations get undocumented, and so it's important if you're on the ground to kind of document and elevate this information to human rights mechanisms as well. Next slide, please. Thank you. And the last example we're looking at is pandemics. So we've recently all gone through one, and we've all been in those lockdowns. And we all kind of have heard or read reports of how sexual reproductive health services became inaccessible to many populations across the globe during these lockdowns. So it was reported to be one of the most impacted health services during COVID-19. The annual thematic report by the working group also says that during the pandemic, several countries restricted abortion services and suspended operations of mobile services, providing basic maternal health and family planning services. And the Guttmacher Institute report, next please, said that a 10% drop in reproductive health care during COVID has this amount of consequences. It leads to almost 15 million more unintended pregnancies, 28,000 more maternal deaths, 49 million more women with unmet need of modern contraception and whatnot. Next, please. So given all these examples, we want to share some conclusions, key takeaways, and even ways of moving forward from here. Next, please. Some of the key takeaways are using the human rights system. I know it's often considered that, oh, it's the United Nations, can we even use these mechanisms? But these international human rights mechanisms is for everyone. We can all use it. If you're a civil society organization, you're a grassroots organization, you are an international organization, you work in any of these spaces, whatever capacity you come in from, even as individuals, you can use these mechanisms, and irrespective of what region you come from, these mechanisms can be used and should be used more extensively. Next. We have to recognize that sexual reproductive health is a crisis in itself. We have to work under that assumption and recognize that in times of compounded crisis, we would need more and more assistance and efforts into sexual reproductive health initiatives. We would need more initiatives and efforts for sexual reproductive health in times of crisis. The third is that we need to be better prepared for crisis. And we need to ask that question of how can we best prepare for managing crisis in our respective regions or countries? And how is it that we can form these consortiums or organize ourselves for this local level preparedness? So obviously, states are making these broad national policies, etc. But what is it that our organization and we can do at the local regional levels to work on this preparedness a bit better? Because if we are working under the assumption or the hypothesis that crisis is now a continuum, we would need that preparedness plan, and we would need to use it over and over again. Next, please. And like I mentioned already, I think it's very important to document research studies, project findings, any other relevant information, and use it for advocacy in your space. Over to you, Daniela.
I just wanted to make a comment on some of the things that you mentioned here on your slide before I go on to mine. So when Bhavya was talking about using the human rights systems and mechanisms, it seems daunting the first time that you see them. But in reality, they're made to be as simple as they could possibly be. And you don't have to be a human rights lawyer to use them. You don't have to feel like you have to have perfect English, French, or Spanish to do it. You don't have to be able to use very highly legal or legalistic language. What's important is to use the systems. And as Bhavya was talking about preparedness for crisis and asking how we can best prepare for managing crisis in our regions, I was thinking about strategic reserves. Do we have menstrual pads in our strategic reserves? Like, this is a very basic question, but it's, about when governments are talking about, what are we going to put in our strategic reserves and how much are we going to invest in them? This is really something that we, as women human rights advocates, have to think about, and it's something that we can put on the table. One of the things that we've done successfully in Croatia is monitor. What we do is we note the dates of periodic reviews. So we go on the website of the Office of the High Commissioner for Human Rights, note when we're under, our country is under review for conventions that are of interest to us, and you put them in a Google Calendar and you set yourself up a reminder to come 6 months before. So it's kind of reminding you to participate in a mechanism that exists for you. It's also a good idea to monitor calls for thematic submissions. These are a little bit more tricky because you have to go to the website every once in a while and check. But often if you have on your social media some organizations that are involved in using the human rights mechanisms, they'll share things as they come up, or if you're on mailing lists. So those are two ways to get information in a timely way about calls for thematic submissions. In our experience, working on these calls and providing submissions has been very, very helpful in informing them and getting them to say the things that are really important about what we're seeing on the ground. This takes us to networking and working with organizations or coalitions in your country or region. So this could be coalitions that are for human rights, that are for that are feminist coalitions, or just any coalition that is involved in the area of work that you are interested in. When there is an important issue or case, write a submission. The example that we gave earlier about the Čavajda case, which happened in Croatia this summer or late spring, when a woman was denied an abortion that she had the legal right to, was an important moment where we then took all the information that was available in the media and we wrote a thematic submission. You can also request country visits and monitoring. So when something happens that's really out of the ordinary, or there's a situation or a really big and glaring problem, you can always ask one of the special rapporteurs to come and have a country visit. And just the whole pomp and circumstance that comes around that visit, but also the media coverage, is also a good way to improve the situation, but also to raise awareness in your country. And that brings us to communicate, write press releases, put information online, and use social media. If you do a submission, or you're working on monitoring, or you're requesting that a country visit happen, it means nothing if you don't communicate this to the media and to people in your country. In our experience, using the media has been extremely helpful. As strange as it may sound, governments really don't like to be embarrassed. And for them, it's very important that when somebody from an international body comes to visit, that everything looks and is as good as it can be. And this is a very good opportunity to have concrete asks of the government, but also to insist that certain things are communicated regarding the situation and that is realistic in your country. And finally, learn and empower. Attend trainings, organize trainings, encourage youth and newcomers. In the space that we are in maternity care, often we were kind of the unlikely suspect to be an ally in the space that was usually previously talking about more about access to abortion and contraception. But we really are a good ally, and working together and training younger people and new people who are coming into the space has proved to be very, very fruitful and very effective in not only raising awareness, but also changing the standards and of what's acceptable in our country. That's all from Bhavya and I this evening. Thank you. And we are welcome and open to any questions that you may have.
Thank you so much, Daniela and Bhavya. We've had a little bit of dialogue and sharing of resources and whatnot going on in the chat. At this time, I'm happy to start turning to questions. Just by way of reminder to everybody here, at the bottom of the screen, there's a little button that says Q&A. You can input a question there. We currently don't have any questions in the list, but we're also Q&A. If it's easier for you just to write your question in the chat, you can do so, and I'll note and share.
I'm just looking at some of the things that were coming up in the chat as people write in their questions. But yeah, you give a good example where you put some examples of previous reports that countries have written. And that's something that's been very helpful and inspiring to us. When you look at what some colleagues have done in another country, it gives you a starting point and helps you figure out where you can begin.
I did a really cool job of outlining.
I think we're back.
Yes, I think so. Yeah, Angela, I think you were saying something. We lost you for a second there.
Yeah, sorry about that. The internet from my end. So yeah, no, I was going to comment that I think Daniela and Bhavya did a really beautiful job of outlining all of those different options. There's a mosaic of options, even if you just look at the UN human rights mechanisms that you can use to support advocacy. If you're familiar with some of those already, hopefully this added to your understanding. If you haven't actually gone through any of these processes or procedures, there's a lot of ways that you can get training and support to find out about them, which is part of the work that we do. I know that Daniela's organization also does this work in the region and at the national level in terms of training. But I'd like to reiterate what was said, that before you have engaged with the mechanisms, they can seem a little bit intimidating, but actually human rights law is very different from, say, going through a criminal law court or any other type of court. It's meant to be friendly and accessible. So even though there are forms and things that you have to ideally follow to help them manage the administrative processes, I would also add that generally the UN staff that support the human rights mechanisms, as well as the independent experts themselves, they don't want a form to be a prohibition for you accessing them. So if there are, if you need to get information in other ways, you can also reach out to the various special procedures. They're very responsive and really want to hear from people on the ground and not have barriers in the way. So I think that that's something really important and empowering to know about your engagement with the mechanisms. And I already mentioned this in the box. I shared a link to the report that Bhavya's organization submitted that she shared some of the data with today. And that was a general call, just like Daniela had just described, right? There are annual calls. They want your input. They want to hear from you. It doesn't have to be a 100-page research paper, but it has to be good, reliable data. And if you're working, especially if you're doing frontline on the ground work, you have access to that data, right? It's just putting it in a form to get to them. So I wanted to mention a couple of those things there. And now I'll turn to a couple questions that we've received. First question, asking to you, Daniela, if you could provide more details on the process of submission regarding denied abortions.
Bhavya actually wrote that report, so maybe she would be the good person to talk about this. She spent a lot of time on Google Translate, and she learned a lot of words in Croatian that she probably didn't know before.
So we had a case earlier this summer in Croatia of Mirela Kaveda, who was denied legal abortion in Croatia. She was around 20 weeks pregnant when she discovered that her fetus has a tumor and that it might not have chances of survival. And so she was subtly recommended to go through abortion because most of the doctors in public health facilities in Croatia use something called consciousness objection, which is that they would object going through permitting an abortion after 12 weeks, which is the legal limit. But the law says that if the fetal is malfunctioning or has any issues like the tumor, then it can go through legal abortion. And she was denied that right in Croatia, and she had to unfortunately go to a neighboring country, Slovenia, and get that abortion. And there was obviously a huge public uprising on this, and Rhoda kind of led a lot of, there were a lot of protests across Croatia. I think 9 cities in Croatia, and Daniela can add some of that information, where this case then kind of was popularized and it came to the limelight, and Mirela finally had to go to Slovenia and get the abortion, which was really sad. And that abortion costed her a lot of amount in euros, which is, if I remember correctly, almost an equivalent of half a year's salary of an average Croatian. And so this was an example of how, the increasing fundamentalism in that country kind of led to a basic access, a legal access to abortion. And what we did was we documented this case. We took information from Mirela. We worked with human rights experts in the region, and we documented this case. listed all the violations that we felt were there, and we sent it to several special procedures bodies, like we sent it to the Committee on Torture, we sent it to the Working Group on Discrimination Against Women and Girls, we sent it to the Special Rapporteur on Violence Against Women. So we sent it to different special procedure bodies and reported this case. And maybe Daniela can mention if we've heard any responses, because we recently submitted this report, and maybe Daniela can add if there was anything we heard, or where did this case go on to?
Yeah, so it says my internet connection is unstable, so I hope that you'll be able to hear me. So we submitted this report just before the summer holidays. Bhavya did a very good job of basically telling the story of what was happening using media, information that was available in the media. So we weren't taking any sort of personal information. We were submitting as an interested party based on, media reports, and we had a lot of citations about basically, what was happening through media articles. The problem in Croatia is that during summer holidays, it's really difficult to do anything. So we've kind of sat on the information about submitting our document, and we're planning on coming out with that through a press release later this month. Once we come out with that press release, then we're going to kind of enliven the topic again. So when we look at the timeline, this happened in April, May, and then it went over a little bit into June, and then we had the summertime, which was traditionally not much happens here then. And then now we're going to bring the topic into the national focus again through press releases saying that, we've written to the UN special procedures as a result of this case and the inaction by the state. So we'll know more over the upcoming weeks and months to see what the reaction will be. I'm not confident that the government is going to do something tomorrow, but I'm really confident that public sentiment has changed regarding abortion after this case. Angela has frozen on me.
Yeah,
also for me, but I think she's back.
Mm-hmm.
Okay.
Yeah, I'm sorry, the internet seems to be going in and out for each of us a little bit. Everybody hear me okay?
Yep.
Great. I might just add to that. I think the process by which the UN special procedures, when you submit a communication, which is a direct information that you give them, not for their reports, but when you're calling attention to a human rights violation or a situation, it has its own internal process on their side, right? So they have to evaluate it for the credibility, decide if they're taking it on. But the special procedures then communicate to the government, the state party that's involved. And this is reported also to the Human Rights Council. The response of the country, if they give one, is reported. They'll put out a press release sometimes. So sometimes what happens on the UN side can take several months. But of course, as soon as you've submitted your own report, you make your own advocacy strategy on how to take that forward, right? If a press release comes out from the special procedures, you can use that. You communicate with them about that, for example. When then eventually the state's response or non-response is published, then that's another opportunity to bring attention to it. So you kind of have to understand the steps of the process, in part to maximize your engagement and work collaboratively with the UN staff and the independent experts on that, which is a very different process than taking information to a treaty body, right? So like the CEDAW committee has its own time cycle aside from cases through the optional protocol. So there's multiple avenues that we're talking about here. That's what I was trying to say earlier, that there are multiple ways to get information in. One of the most time-sensitive ways to get information is exactly this, through a communication to the special procedure, which I think is why we're emphasizing. It's a fairly easy to use tool compared to having to build a case for the optional protocol. So there was a question from Katarina, which kind of speaks to this, which is if we could detail how to submit country cases, mentioning that the UN pages are confusing, it's easy to lose your weight. way. So in specific, she said, how do I submit, for example, a collection of reports of birthing during COVID, such as infant mother separation, birthing without a companion, etc. So maybe I'll turn that back to you, Daniela, if you want to give some recommendations on what to do with that kind of repository of information.
Yeah, so the Office of the High Commissioner for Human Rights has recently revamped their website. So give it a go again. It seems a little bit easier to use now, although they have changed some things, which makes it a little bit confusing. What I would say is how to submit a country case. When you're talking about a country case, I'm assuming here that you mean a situation in a country, just like we did for our submission. To the special procedures. And in that case, you basically write it up and you send it to the special procedure that you think is the most appropriate for the topic that you're talking about. Another way of doing it is using the writing a shadow report. So waiting for the country to have its, what do you call it when they have the review? They have a periodic review every 4 years. So basically it works that, when you sign on to a treaty or a convention, that doesn't mean that you've signed it once and never again. There is a reporting process. So usually 4 years, the UN basically knocks on your door and says, hello, how are you doing according to this? And let's have a look and see, if you're listening to and doing all the things that you signed on to say that you would do. And that's what we call the periodic review. Usually every 4 years, sometimes every 5, sometimes it's a little bit late. But that's also a very helpful tool to kind of collect all the things that are happening and put them in a shadow report, which basically means that the state writes a report where they say that everything is wonderful and they're the best at everything. And you write something called a shadow or alternate report where you basically describe the situation as you see it and you put in as much evidence for that as possible. So how to submit, that really is something that you have to think about, either to the special procedures, which you can do at any time, or to the periodic review for whatever convention is appropriate. In this example, I think it could be perhaps the Convention on the Rights of the Child. I know that we mentioned some problems of infant mother separation during COVID there, and we also articulated it in a CEDAW submission, I believe.
Great, thanks so much, Daniela. I tried to put a little summary there in the box just in case anybody's just really getting used to all these different possibilities. Another question that came in, is there any country that has requested, to your knowledge, is there any country that has requested that female sanitary products be in that country's strategic reserves? They find the idea revolutionary, but definitely appropriate and necessary.
Do you know of any, Bhavya? Yeah, I mean, this is something that just occurred to me as Bhavya was speaking earlier, and I think it would be interesting to see what, which is basically the warehouses of things that they have just in case. And it really would be interesting to see what items are there specifically for women, and that, the example here based on what Bhavya was talking about were menstrual pads and menstrual products, but it could be any wide variety of things. When we're talking about essential medications that are on the strategic reserves, are there medications that women need for their reproductive health? So I would invite you to have a look at some of those long and boring documents about what your government keeps in its strategic reserves, and try and find some of the sections that could pertain to women. It's all about looking at things with a gender lens, and that's something that we're only just starting to do in many areas. In some areas we haven't even started, but we're never going to start unless somebody starts talking about it. And these kinds of stories, at least in the Croatian media, would actually, have I think that the media would be interested to an extent, saying that if you were to come out and say, all these women's products or things that are used exclusively by women or mostly by women are not available in strategic reserves.
Yeah, and just to quickly add to that, given my study that was conducted in 2020, the Indian government was rarely involved in responding to this crisis. It was mostly the humanitarian organizations and the local NGOs that kind of came together to create these safety and hygiene packages for women. So I don't think in a lot of cases it's even, something that the government is actively engaging in. And also, since I'm on this example, I quickly also want to recognize a comment in the chat by Ritu that using old cloths is better than sanitary napkins. And I completely agree with that. If they are dried, they're sun dried, and they're, they go through this process of making them hygienic and reusable again, then yes, they are. And of course, there are several communities in India, and I'm sure in other countries as well, that do use, that prefer using cloth pad as an alternative to any other menstrual hygiene product. But in cases of floods and these crises, oftentimes there isn't as much, with the floods, obviously the climate is a certain way, it's very damp, it doesn't get the proper sunlight, it doesn't get dried, and obviously for hygiene reasons, they are given sanitary napkins for use, but it may or may not be used by the women who get them, because they might have never used it before, and it might not be something that they're comfortable using or know how to use even. So in that context, it was really difficult for women to use sanitary napkins, but sanitary napkins were a safer alternative to using cloth pads. Thank you.
Thank you, Bhavya. We've had a question in the chat that's more a request for resources. I'll see if I can put some things in the chat around drafting cases for CEDAW individual complaints. So, which is submitting a complaint to the CEDAW optional protocol is the most legalistic format of all of the processes. So generally having a lawyer to help with that process is advisable, just to ensure that the case is acceptable, and that the CEDAW committee takes the case, because they reject a lot of cases where it's not made very strongly. That said, I'll share some resources in the chat. There are a number of different organizations, including International Women's Rights Action Watch Asia Pacific, that supports the shadow reporting and advocacy process for NGOs at the UN that also have resources on the optional protocol. So I'll share some there, but I would say that it's always, if you're going to submit a case to the CEDAW optional protocol, just like you would with any other legal procedure, it's not a short-term measure, it's not an interim measure, it's really where you're trying to push for structural change, that it's worth putting in the time, the effort, the resources needed to take a case forward. And I don't say that to discourage anybody, but just to be aware, to really look at what is it that you want to accomplish. Is it, if it's really getting publicity, naming and shaming your government to try to make things happen, it's much faster to use the special procedures, for example, or to participate in the CEDAW review. So those are some of those, we tend to think, oh, well, we want the OP, the optional protocol, because it is the most binding, but actually there's a lot that you can do with a really effective advocacy strategy without having to go through the optional protocol. That said, it's a really important avenue as well. I don't know if
I just add something to that.
Yeah, go ahead.
So when we think about these UN systems, we also have to realize, like, the UN doesn't have a police force that comes out to enforce the things that they say in these countries. So these are recommendations. And when we say recommendations, it's in a very diplomatic way of saying recommendations, in the sense that countries generally will want to adhere to them because of the international embarrassment, like Angela said, naming and shaming. But you can't expect that, you get a comment or some sort of communication from a special procedure or anybody, and that the next day something is going to change in your country, or that the government is going to make some sort of monumental change just based on that. But what you can do is use it for advocacy, but also in other cases that you may be bringing to court. And for example, if you have a positive commentary or some sort of positive answer from one of the special procedures or from a CEDAW, you can use that as part of your argumentation. So it's always helpful to use. It just doesn't have that kind of automatic things are going to change tomorrow aspect.
Great, thank you. Another thing is important to also familiarize yourself with the cases that the CEDAW committee has already picked up, and there may be specific recommendations that you can extend and apply to your context, as well as to see the kind of recommendations that, that come out in the way that they take up the issues. I'm just trying to see, we've had a couple comments in the box. One is around the issues for Ukrainian refugees, not only in access to menstrual products, but contraception, condoms, IUD methods, etc., should be included in emergency reserves, and the need for a holistic view, I guess, of sexual and reproductive health and rights in context of conflicts. And then there's a commentary on I'm summarizing here what Du has said, but essentially the way that I'm understanding the comment is really, even before the crisis comes, there are not adequate supports, means, and everything. So, without that groundwork in place. So I wonder if either you would like to respond to either of those comments in the chat.
Yeah, I mean, I totally agree with looking at sexual reproductive health in a very holistic manner, because we have to understand it from a life cycle approach and not just have a lot of organizations on working on one major chunk of it and then the other parts of it gets lost, because the reproductive health goes across the life of a woman. So even if you give her great maternal child health services and that the other services are missing, that's an issue. So I totally agree that we have to look at it in a very holistic manner and plant interventions or even have emergency reserves that are necessary for women at different stages of their life, women at different women of different age groups, women with different needs, and we kind of have to build that on in. And like I mentioned earlier in this presentation, my framework, that it is even more important to look at marginalized groups. So within women, are we including women with disability? Are we including indigenous women groups? Are we including rural women? So kind of start like looking at those layers as well and see how sexual reproductive health can holistically be catered to across the life cycle to different populations within the larger women group as well. Yeah, and with respect to the other comment, I completely agree. I mean, the findings from my study, have come out over and over again. These floods that happen in India are a result of monsoons, and they come every year, and we see crises like this emerge every year, and we are still facing very similar challenges. We definitely need more groundwork, and I'm sure that similar findings are there across regions and in different countries as well. I mean, it's not hard to believe that, but I agree that we need to start building some of these things into our preparedness plans and even start looking at what we would do before a crisis strikes. I mean, think of it, if your orientation is thinking of that sexual reproductive health is a crisis in itself, and there's just going to be these crises after crisis here on, what can we do as people working in this space to ensure that these reproductive health needs of women and girls are catered to for all generations.
Thank you. I shared a link in the chat to ERA Asia Pacific, International Women's Rights Action Watch Asia Pacific's resources. They actually provide logistical, even for women and those that want to. And you can find a lot of information there about upcoming sessions as well. So the countries that are going to be reviewed in October 2022 are listed there, for example, as well as for future sessions. So they serve as an intermediary to engage with the CEDAW committee to really amplify women's organizations' engagement. So if you're not familiar with their work, please do check them out. We're getting close to the end. I don't see any other questions, but I wonder if I might take moderator's privilege to ask a question. And it could be, for both or either of you. I mean, I think you did a beautiful job already of sharing some examples and case studies in particular contexts, but I wonder if you have a specific example that you might share in which your advocacy has paid off and how. If there's something that you can talk about. For example, if you did a particular, shadow report or engaged, on a particular issue at CEDAW where you actually got the government to move, or the specific impacts that you saw from any of those reports that you had submitted to the special procedures, for example, just to kind of capture everybody's imagination a little bit more.
Flavia, do you want to try that one out?
I can give it a go, yes. So in my case, unfortunately, India has not reported at CEDAW since like almost a decade now, which is really unfortunate. And I'm waiting for that moment to come for me to put in my shadow report, but it's just not coming. So with respect to working in that space, I haven't unfortunately had the experience of or exposure, but I can say that the submissions we gave in for the special procedures for that was the working group on discrimination against women and girls, we did see some of these inputs that were incorporated in the report, not necessarily using the same language or giving examples of the country, but broadly under the framework of what can state parties do to respect and protect human rights, particularly women rights in this case, in their countries. And I think this report was very well received by most governments. So I hope that in future, we will see a lot of these governments kind of using some of these suggestions and recommendations into their policy work.
I'm gonna have to say similarly that we've done a lot of reporting over the last 5 years. I can't say that there was some sort of enormous win on our side, in that the government came and, did something dramatic. But on the other hand, we have nudged the needle in what norms are in a number of areas regarding women's rights, which basically means that some of the things that were perhaps possible 5 or 10 years ago, right now would not be possible just because public sentiment would make them impossible. So using the special procedures and the shadow reporting for us has been important for our advocacy and important for raising public awareness and important for changing some of our social norms. Although, we haven't had a government come in and say, okay, we're going to do 10 of the things that you want, or 5, or even 2. We've been advocating for a long time now for an action plan on women's health, and the government has basically been ignoring that. But it may be that, in one of the points, one of the governments that will come in the next 5 to 10 years, that may be a talking point that they'll pick up, saying they didn't do it and we will. If we didn't do this work, the situation would be worse. Or it would be the same, but when we say the same, it would be the same unchanged, situation that it was 5 years ago. So it does pay off. It just really is a marathon, and you just have to be ready for that.
Thank you, Daniela. And I think that's a really important reflection in the sense that, often we hear from folks who haven't engaged with the mechanisms, or maybe, are just thinking about it. Well, my government's not going to do anything, or, what is going to result directly from this? But the vision that we're trying to put forward is, you're already doing advocacy work. Right? Or you want to do advocacy work, or amp up your advocacy work. So there are both mechanisms as well as frameworks, meaning the norms, the human rights language, all of those that you can integrate into your long-term strategies as you move along. So no single strategy in isolation is going to change the world. We all know that, and we shouldn't expect that from the UN mechanisms either. That said, moving that needle along, shifting the discourse, even just seeing how that happens. And even if you go to CEDAW, for example, during the session when your country is being reviewed and your government representatives see you there, that can even, amplify your ability to impact at the national level. So there's a lot of opportunities.
I think we have lost Angela again.
Yeah.
Yeah, my internet is going in and out. I have to apologize. Am I audible now?
Yes.
Yeah.
Yeah. So I don't know where I cut off, but I think I already made my point, which is that ultimately this is a long-term game for change, and these mechanisms offer really powerful tools to help amplify our voices over time. But we get as much out of them as we put in, right? So work it into your strategy, build your ability, your strength to use the human rights language to call your government out for their lack of accountability with confidence, right? Use that language. So that's part of the importance of, maximizing the opportunity with these mechanisms. So I think
it's also important to notice that when you're working with the government, talking about these types of things, aside from changing societal norms, also creates space where other members or younger members or junior members or new members of governments can also take up the topics. So if nobody's talking about them, nobody's ever going to pick up the topic. But if you sensitize the public enough and sensitize the politicians and the diplomats enough, these are topics that they may pick up later on. And again, we're going back to, if we don't do it, it's never going to happen. If we do it, it's going to take a long time. And Alda Falcio, who's not with us today, has this really good sentence where she says, societal change is generational. It's not something that happens overnight. What we're working on right now is creating a foundation that our children will be able to build on. And it's up to us to leave them as high a foundation and as strong a foundation as we can.
Thank you for that, Daniela. I think on that inspirational note, I'd like to give my thanks to both of you, Daniela and Pavya, for your presentation today, as well as, the amazing work that you're doing, which brought you to the session today. Just before we close, I'm going to ask Laksha to launch. We have a short feedback poll that we would like to ask the attendees to complete today, just so we have a little bit of information about how your experience was in this webinar. The poll should pop up on the screen, and there's just a couple quick questions that you can answer there. We'd really appreciate if everybody does that before we close down for the day. While people are filling out the exit survey, Daniela and Bhavya have given permission for us to share the PDF of their PowerPoint from today. So we will be doing that. This webinar has been recorded. There is an immediate archiving of this video on our Facebook page, which can be shared. You can refer to it there, but the fantastic Laksha, who's in the background here, will be preparing that video and adding it to our YouTube channel. It'll be on our blog as an ongoing resource, and we will do an emailing out afterwards in case you wanted to share this with anybody else. If you haven't already, I'd encourage you to sign up for our mailing list. This webinar series will be ongoing on a monthly basis. During the period of the pandemic, we've been offering online courses. Next year, we're maybe looking at getting back together in person, as well as continued ongoing online learning. So please check out our work as well. And I don't know if either one of the speakers had anything else that you wanted to say or mention before we close today.
No, I'm good.
All right. Well, anyway, thank you so much. And thank you to everybody who was here. The next webinar will be in September. We're looking forward to having speakers talking about the impacts of climate change. Another upcoming webinar in the fall will be focused on popular education and CEDAW, and really how we can play a role in doing that sensitization and awareness building around the convention. And we're also open to other possibilities. So if there's anybody who wanted to propose or suggest a certain topic, you're always welcome to email us as well. All right, so thank you very much, everybody. Have a wonderful afternoon, evening, depending where you are. And thank you.
Thank you.
for joining, everyone. Thank you.
Thank you.
I'm just taking a second because I see
Yeah, no, we're getting thank yous in the chat. I hope the panelists can see the thanks and the accolades coming in. See a lot of familiar names. Nice to connect in virtual space with some alumni and partners. Great. All right. Thank you very much.
Okay. Thank you, everyone. Bye-bye.